My name is Jacquelyn Weber. I am one of the senior practice managers at Orlando Health, UF Health Cancer Center. My focus there is patient access, which covers the wide spectrum of making sure that our patients that are seen at the cancer center, all of the treatment that's ordered by our doctors is authorized. So we work very closely with the insurance companies to ensure that we achieve that goal. We try to take that burden off of our patients for them. We also have a team that works with our patients to make sure that if there's any questions or any issues with regards to their insurance or coverage or anything along that line, that we can try and be a help for that. I've been with Orlando Health for 26 years. I started my career on the acute care side, meaning that I was working in the hospitals that take care of patients that are coming in through the emergency room primarily. They have an incident or an injury, and then they go home. 4 years ago, I was diagnosed with breast cancer, stage 1 triple-negative breast cancer, and my world changed, as all of you know, when you get that diagnosis. And suddenly I was thrown into a very unknown world for me, a very unexpected world for me. Do not have any cancer, very little cancer in my family. And it was time for me to develop a new norm and to learn about things that I didn't know about. Or I thought I knew. I thought I knew exactly how our patients felt. I thought I knew what our patients were going through. But then once you become a patient, your perspective changes. And that was an opportunity for me to say, whoa, are we the best we can be? And so as I was going through the journey, I was becoming a mystery shopper. And I was seeing people that didn't know who I was, looked at me like, okay, here comes another patient. And I said, this isn't good enough for us. And so I made the determination at that point that I was going to do everything I could as a cancer patient to ensure that we are doing the best we can do with Orlando Health. And a big part of that was the financial piece of it. I've worked with patient financial services, insurance companies. I've done that for 26 years now. But like you, I didn't understand all about my insurance. How many of you know everything about your car insurance, your life insurance? Right. We don't know it. We don't know the details until it's time for us to use it, right? And that was the exact same situation for me. I got that cancer diagnosis and I thought to myself, this is going to be so extremely expensive. It's going to devastate my family. Two things, cancer diagnosis and potentially financially. So I needed to find out and get to work on how I prepare myself and keep that from happening. And so that's what we've been working on at our cancer center too, to be able to do with our patients. And I've had the opportunity to speak to small groups, larger groups with regards to how best to plan for that. Often when you're going through treatment, your caregivers, everyone is very focused on taking care of you, which is where they should be, right? They should be focused on that. But the financial piece is another piece of you. And that's one thing that I'm going to talk to you about today, and the fact that we really need to be very, very actively involved in that process. No one has a greater voice with our insurance companies, with our care providers, than we do as patients. And it's time to exercise that voice. So some of the things we're going to be talking about today is how important it is for you to understand all the options that are there for you. Okay? Understanding your health insurance. Understanding what other pieces of information that you have as part of your life that can truly help you in situations like this. Things that we've been saving for, things that we've paid for many, many years that we didn't realize had options for us. So we're going to talk a little bit about that. And we're also going to talk about what other types of funding are there and available for you. Okay, many of you may have already realized some of this, and don't be afraid to ask your providers where you're getting care. One thing that we work very, very hard on is to be able to make sure that if there is something out there that's available to our patients, we want to try and find it as far as assistance. We've developed different teams that are focused on this, from medication support to emotional support to whatever the case may be. So those are the things that we're working on, okay? So let me see if I can get my slides to work for me. All right. So one of the things that we want to make sure, and I'm sure that for many of you, no matter where you are in your journey, you've already realized that cancer care is very expensive. For any of you that are having any type of drug infusions, anything along that line, that is the most costly part of it. But that is one of the areas too where you do have resources and you have help that can help you with that as you need it as you move through. Treatment is possible without insurance. It's a challenge, but it is possible without insurance. And so if you do not have insurance right now, or you know someone that does not have insurance, it's important that they connect immediately with the financial folks at their facility to be able to help with that. I need the blue. Yeah, that's the one that I need. The other thing it's important to know too, yes?
Immediately, those who do not have insurance connect immediately to
your provider. So whoever you're going, I'm sure that in your areas where you live that you've either selected or you're going to be selecting a provider of care. There are many options that could be available to work. We have, for instance, at Orlando Health, we have vendors that work with us that help patients that do not have insurance to perhaps connect immediately and become part of the healthcare exchange, which is open enrollment right now. Or there might be other community or county assistance programs too that they can work with. We feel that's very important and it's worth for us to have a vendor. And so many providers do have something along that line. Good question. Health insurance cannot cover everything. And we're going to talk about how you become actively involved, and it's important for you to know that. There's a lot of trust when we buy our insurance and when we talk to people and they say, oh yeah, you're covered, you're good. But the reality is that your health insurance won't cover everything. And so being very actively engaged with the health insurance is really important. And then there are some cancers, and I'm not sure if you guys are feeling this or not, but there are some cancers that may not follow traditional models of care. And often the physicians will try and have you on a regimen that is considered off-label. And what that means in the simplest terms is that the drug that they're prescribing for you may not traditionally be used for your cancer. It might be used for another cancer, but proven effective through paper and testing and all that other good stuff. Yes?
Avastin is one of those. Avastin is a shot that a lot of people get in the eye that is not, it's off-label use. So this is what you should be talking about if anybody's having problems with Avastin.
Yeah, and Avastin, I'm not sure specifically, but a lot of the drug manufacturers do have assistance programs for certain drugs. Avastin may be one of them. Your provider can help, or you look your drug up, Google everything. I do all the time. And you can Google the pharmaceutical provider of Avastin to see if they have any type of copay or assistance programs that could help you with the funding for that. But insurances right now struggle with paying for off-label use simply in the fact that often they're behind the research. And so where our doctors are trying to be on the cutting edge of finding any possible cure for their patients, sometimes the insurance companies lag behind. Mm-hmm.
So is that similar to when patients are denied because the insurance says, well, this is voluntary or this is experimental?
It could be, yes. Yes, that's often how they categorize it. And it's up to us as providers to do everything we can to pre-approve, and we try to do that as much as we can. We know when the doctors are using something that's not traditionally used for that type of cancer treatment, we know it's an uphill battle for us, but we prepare, and our docs are prepared. Generally, they're making this decision based on research, papers, different things that they've connected with within their organization or within their research that will indicate that this is proven effective.
So just not to get distracted, but the PET scans, for whatever reason now, are not being approved.
Yeah.
At least in California, but I was told it's across the nation. And yet that's based on insurance, but not the recent literature. So how to navigate those waters.
Yeah, we do have challenges with PET scans normally because PET scans can be very expensive. And so there are challenges, of course, with that, especially because they look at a PET scan above a CT and an MRI, and if they don't see that this has been done to the insurance's requirements, then they're not going to let the doctor go from here to there.
Could I put it a different way? That they don't see meds showing up on the MRI, right?
Yeah. And so that's why our docs really, really want the PET scans. The good news is, at least here, is that we are starting to see PET scan availability in some of the freestanding centers, which are much cheaper than getting it within a hospital facility, substantially cheaper. And in most cases, that's where the insurance companies that's where their hiccup is the expense of it. So, yes, maybe getting there. So that definitely has seemed to help us in getting our patients referred. Okay, so the next thing I wanted to talk about is having that discussion with your providers. When I told you I've been with Orlando Health for 26 years, and I moved over to the cancer center when I was diagnosed with cancer. And I took over the access role there. And one of the biggest challenges I had when I moved over into that role was the fact that our physicians were very, very focused on taking care of our patients. And in doing so, they weren't very patient for authorizations. They wanted to get the patient going, get them going as quickly as possible. When questioned if the patient could wait, yeah, they felt like the patient could wait, but they didn't want the patient to wait. And so it was really a challenge for us to get the healthcare providers to understand just how important that financial component is. And we also learned that a lot of our providers we're saying, don't worry about that. That's going to be covered. And it's a true statement because we are taking care of it, but we don't want our patients not to be in tune and active about that. We certainly don't want it to be a worry. We want the treatment to be the focus, but we also don't want it to be an end result after treatment is done or anything along that line. So we really encourage you to have open discussions with regards to the financial piece of it. So how many of you guys have really looked at your insurance cards? Pulled out your insurance card, taken a good hard look at your insurance card. How often do we do that? The insurance card is a very valuable tool, and it's something that we talk about in the fact that it gives us so much information in order for us to really have a high-level understanding of what the expectations are of the insurance. And so one of the things, I'm not sure if it's in the handout or not, but it was definitely something that I had to show you guys, and I'm sure you have pulled out your insurance cards before, and you could see the fact that there's so much information on there that we need to make sure that we have what we have as far as, hang on one second, how you reach your insurance company. Often there are co-pays. There's information that's available to you on that insurance card that could answer a lot of questions. Now, one thing I learned very quickly about my insurance card was when it came to the specifics of my cancer treatment, it didn't give me all the information that I hoped that it would. And, I've tucked this little insurance card in my wallet away as soon as I got it in January, and I expecting that when I needed it, I could get out and I could look at it. But it didn't give me all the information that I needed. So it's important to know that your insurance card is going to tell you what type of insurance you have. There are so many different types of insurances out there. Some are very open, some are very restrictive. The main insurance that's out there is an HMO that you've probably heard of. And the HMO generally requires you in one way, shape, or form to have a primary care physician that's your support mechanism in driving your treatment. There are different types of HMOs. There are point-of-service HMOs. There's fee-for-service HMOs, which often are more restrictive with regards to the network, the doctors, who you can see, whether you require a referral or not to see a doctor. All of that information is really, really important. The primary care physician often starts that cycle for you. And if that isn't started appropriately from the insurance company's perspective, it's going to create problems downstream. So make sure that you really get to know your insurance plan. And it is open enrollment time for a lot of employers. It's open enrollment time for Medicare plans. It's open enrollment for the healthcare exchange. If you're looking to get a plan, look at the plan that's going to be best for you. Call, ask questions, find out if it's something that's going to cover you or your family or whatever the case may be for your cancer treatment or any other treatment that you're concerned about. This is the time to look for it. Patient insurances are not allowed to deny coverage for pre-existing conditions. That's part of the Affordable Care Act. So if they're group plans, if they're part of that, they can't do that. So make sure you're choosing one that is right for you. Very, very important. There are also some state-specific plans, which are the Affordable Care Act plans, healthcare exchange. Those vary from state to state. Also Medicaid plans. Now Medicaid, is an option. If you don't have insurance, you have to meet financial criteria, but it can also be an option as a secondary plan as well. So if you have a high out-of-pocket and you might not meet financial criteria to have Medicaid, but from a supportive plan such as Medicare, if you have Medicare only and you don't have a supplement to Medicare, sometimes you could meet the financial criteria and you could have a Medicaid plan as well. But those are all different by state. Okay? One thing that when it comes to managing cancer treatment, as you're dealing with your insurance, there is no one that has a more strong voice, a more direct voice than the insured. So use that voice to get the answers and to get the information that you need. I recommend that when you have that conversation with your insurance and you start talking about treatment, ask them if you can have a case manager. Ask them if you can have someone that is a point person for you that you can speak with each and every time you have an issue. Now, we recommend this simply because of the fact that from an authorization perspective, we get different people all the time. And guess what we get every time we get a different person? A different answer. So asking for that, I don't know if all insurances have that or if that's possible, but ask for it and say you want someone and you want their number, you want their email, you want to be able to reach that person to get your information. Yes?
And get the number.
Yes.
Not the phone number, but the number that they assign to your specific claim, and write it at the top of your clipboard and use that number. So if you
Absolutely.
will get a case manager because they don't want to keep talking to you.
Yeah.
Always have that number, so then they've got the same screen every single time.
And that's my next note. Thank
Okay.
you. It is, yes.
Life experience.
Yes. As you're going through it and you're gathering information, and they will assign you, it's usually a reference number or a case number, use that, record that, have that with you each and every time you call, for sure. Okay? The other thing too is always make really careful notes. So every time you have a conversation with your insurance, make sure you write it down, the name, the date, the information that was provided to you, all of that to keep as a reference. Because I guarantee you're probably going to have several conversations with your insurance company. And then most insurance companies are really good at this now, but ask for approvals in writing. Most of the time when there is some sort of approval or reference or referral that's done with your insurance, you will get a letter. But if you're not seeing that, I would say ask that right out of the gate and indicate you want that. Yep. We generally get a copy of it too, so which is really nice. Is the provider gets a copy of it, the insured gets a copy of it, but we want to make sure that that happens so that you guys are fully in tune to what's going on. Mm-hmm.
If I could add, if you're taking good notes and you have a bound notebook, it's more credible. It's in your handwriting and it's bound and it's consistent and it's dated and who you talk to and your plan number. It has more credibility.
Great. Yeah, that's great. I tell you, you guys are very powerful, and I learned that too as I was going through my treatment. I didn't quite realize how valuable we are as insured folks with the plan, and how important we are, and how critical our voice is. We work, and most providers will work on your behalf to get pre-authorization for care. We're getting there, yay! will work on your behalf. We do. It's very important for us. But make sure, and when you're having these conversations, ask that question with the insurance. Do I have an approval? Is there authorization on file? Get that information as well. But you should also be receiving letters when that occurs, so that you would have that as part of your documentation. But if you're not seeing anything, don't think that things are happening necessarily. Take that extra step. Definitely good advice. Look at your bills too that you're getting. Cancer treatment, there's a lot of stuff that goes on. You know, you go in for your chemo, and there's a lot of things that happen. There's a lot of things that happen in order to, it's still not working right. There's a lot of things that are happening. No, that's okay. I think it was frozen on that. This is okay, right? If I'm just looking at my notes, we're okay? You can look at these lovely faces up there if you'd like. You know, make sure, look at your bill. You may not see every little detail, and you may question some things and say, I don't remember that. You know, just become familiar with it. You can certainly question it. One thing that I will caution you on, though, is that often if you get accustomed to doing audits on your bills all the time, I will tell you that a lot of companies, they'll go back and will audit for you without any problem. But if charges were missed, charges will be added. If charges were done inappropriately, they'll be taken off. But it's quite a process. And, you know, if your insurance is good with it, you know, because you'll look at the hospital expenses and it's very high. And you'll think, my gosh, that's very high. But, you know, everything is negotiated with the insurance companies, but you have a right to question your bill at any time. And every provider should work with you on that. One advice that I really like to give is really be cautious of your explanation of benefits that you get from the insurance companies. It's very common for them to deny treatment. Okay, it's very common. You'll get an explanation at the first pass of treatment. It's very common. So especially if you're going through chemotherapy, which is so expensive, and you see an explanation of benefits for $80,000 for the drug that you just got, and it says denied, you owe $80,000. Don't panic. Immediately reach out to your provider, reach out to the insurance company. Hopefully you've got Stephanie's name from Blue Cross in your pocket that you can call and you can ask a question of. And then you'll have the information from the provider that will be able to go back, or from the insurance company that you can go back to the provider and say, why am I getting this message that this is denied? And most insurances will do it. It's just that they just deny the first pass. And generally, by the time you're getting the explanation of benefits, we're already working on if they've asked for additional information, if there's anything along that line. It's common. So I would just say, please, I'm probably messing you up because I keep touching it, I feel like. I'm sorry. Is that just be cautious of that. Don't let it panic you, all right? You can also appeal anything that's denied. We do it customarily all the time. You have that right as well. So if your insurance company tells you, I'm sorry, we're not going to pay for this, you have the right to appeal. And they will put you through the process, whatever it is, and we as a provider will work with you in every way we can to successfully win the appeal. And we are generally very successful. Sometimes it takes some time for us to do that. But as a provider, we work with you. We don't hound you for the bill. We work as a partner with you to get that overturned, because we want to do that as well too. Make sure that you keep copies of every letter that you get, especially if it talks specifically about denials. We want to make sure that you have that. Make note of appeal deadlines. That information should be provided to you. Make sure that you're aware of those and you follow those, and it's not something that sneaks up on you as you're going through the process. And, we've already talked about making sure that you keep careful notes as you go through that. Depending on what type of plan you have, you may want to consider, especially if you're going through the appeal of a denial process, if you have a plan that works very closely with your work, you may need to get your human resources folks involved to help as well. You may need them in your corner to help support. If it's a state agency that you work with, then there may be, state representatives that you would need to work with to help as well. Get everyone involved, because we do want to help. And often you know about things before we do. I do want to remind everybody, if you don't have insurance right now or you're looking to make any changes, I mentioned it already, the open enrollment is right now for the healthcare exchange in every state. Every state offers different plans. Last year in Florida, we had one, Blue Cross. We had one plan. This year it looks like we have more. With more options, but a lot of the plans, be very careful too as you're looking at plans and making choices. Some of them are regional, some of them are very specific, some of them have very high deductible out of pocket. So really be thoughtful with the plans, and remember, you cannot be denied for pre-existing condition. You want to work with something that's going to help you from a bottom line be able to support it, but then you also want to make sure that it's getting you the coverage the long term that you may need. One area too that a lot of people may not remember is if you're going through treatment. We see this with a lot of our patients as they're going through treatment and they may not be able to work anymore because their treatment or their condition gets to the point where they just cannot continue to work a full-time job. There are COBRA benefits. If you're not aware of them, they are available to you. And so you have up to 60 days from the last day that you work to agree and to reach out to your employer and say, I want to keep my insurance. Now you'll have to pay the full premium, which many employers, it's varying what they contribute and what you contribute. But you have that by law, you can keep your insurance. And it varies on the amount of time that you can keep it, but you would keep your same insurance that you have now. You would just be responsible for the full premium. Yes?
Does it affect the employer at all if I go on COBRA and pay the full fee? Like if I quit my job versus I go on unemployment, the unemployment affects my employer.
Right.
So does it work that way?
No, not that I'm aware of. Because as far as the insurance is concerned, what they're doing is they're subsidizing part of your premium. They wouldn't be doing that anymore. So you would be paying that. Good question. The COBRA eligibility is if you leave your job, laid off, have your work hours reduced, have coverage through someone else, and that person no longer maintains that coverage. Or for, if you're the 25, 26-year-old that's aging out of the ability to stay on, they can carry it as well. Areas that do not offer COBRA is anyone who works for the federal government. Certain church-related organizations do not offer COBRA, and employers who have fewer than 20 or more employees for at least 50% of the year. Those would be the only exclusions. Large organizations, all of that would require it. That's about it on COBRA. Let's see what else we have here. I wanted to talk a little bit. We've already talked a little bit about the Affordable Care Act, and it does have requirements of coverage. What is driving most plans these days are preventative care. And so, of course, they're wanting the preventative piece to be in the forefront, to work its way through as additional care is needed. We also, too, as part of the Affordable Care Act, and I think you guys have a session on this, which talks about the Patient Bill of Rights. Yeah. So the Patient Bill of Rights is going to differ, and it differs. The main pieces of it is you have rights as a patient, within the healthcare, as a provider, we have to make sure that we're meeting those rights. You're going to have that's also all part of the Affordable Care Act. So you'll have some discussion on that. We talked a little bit about Medicaid. Yes?
I have a question.
Mm-hmm.
When you were talking about COBRA and stuff, at what point do you happen to know with the disability process, would that kick in? Like short-term disability or long-term disability? Do you happen to know?
I do not, but I know we have short-term and long-term disability as well. There is an approval process. I don't know if you are on short-term disability or long-term disability, well, short-term for sure, you're still employed. You're on short-term disability, so COBRA would not go into effect. You would still be benefiting, yeah, as an employee. The long-term disability, often you have progressed to a point where you can no longer work. So I'm sure if you speak to your employer, they would talk about how they price the insurance. I don't know if it's fully COBRA or if there's a pricing model that follows based on your employer.
So here's another question that you may or may not know.
Uh-huh.
Is there somewhere else to possibly call to find out answers to these questions? Because obviously it's a sensitive topic to go into your, say, small office and be talking to human resources. And if it's a small office, it's very quickly get back to your boss that you're asking about these things when you may not even be ready to be at that point.
So for COBRA, let me give you the website that I have for specifically for COBRA, and that is www.dol.gov, and it's /EBSA. EB as in boy, SA. Now, as far as your long-term disability, I know for Orlando Health, we have links that we can go and learn more about our disability programs. It might be worthwhile for you to investigate if you have a website or if you have any documentation that was provided to you with regards to the long-term disability or your disability packages, to look to see who the provider is and to see if you can reach out and get those questions answered.
Okay, thank you so much.
Yeah, you're welcome.
You can also apply for Social Security.
Yes, right, right, if you met the criteria.
This can be really helpful to you for federal Social Security disability, and then most states have a Department of Labor office.
Yeah.
And they can help you understand what the law is in your state.
Yeah, and
What you're supposed to
I was going to say, and on the DOL, the Department of Labor site, you'll probably find some information about that too. Social Security is great. We work with our patients all the time to try and help them get the disability through that. It's just such a lengthy process. It really is such a lengthy process.
I was kind of totally glazed over. I thought Social Security just, covered like when you retire.
Yes.
Or something. I lost my first wife to cancer, and when I was in that process, I started learning about Social Security, and they provided a benefit to each of my kids because my wife had contributed into Social Security. And it's like, okay, she actually earned this benefit, even though she's not ever going to benefit from the retirement side. There is the disability part, there is, a benefit for your kids, and it is amazing, actually, and they're very, very helpful when you go in and talk to them.
Yeah, that's great information. And I was just going to talk about Medicare and the fact that once you turn 65, you get Medicare Part A. That's the entitlement that you get. And Part A is the hospital. So it covers you when you're in the hospital. The piece that you have to pay for is the Part B piece. And that is the outpatient coverage. That's cancer treatment for the most part. And a lot of folks overlook that. Please make sure that if you are becoming Medicare eligible, that you understand that. And again, there's open enrollment right now too for Medicare, Medicare plans. So if it's, if you're to the point where you're looking at options, it's a great time to do that. And right now it's an automatic and will go into effect January 1st. But please don't forget about the Part B piece. And generally there is an 80-20 gap of responsibility with Medicare only. That's why it's very good to have a supplement plan, to choose a supplement plan. Now, when we say 80-20, we don't mean you get billed $10,000 and you're responsible for $2,000, okay? Every provider has contractual agreements, and we have a fee schedule that we pay for Medicare, so you're responsible for that piece of it. And you also have a deductible to meet. So there's a lot of value in having a secondary plan for Medicare. The other piece too is Part D. If you're familiar with Part D, if you have Medicare, that's the drug piece of it. There are many different pieces of it. There are just so many questions to be asked about that, especially if you're going into treatment. What might be covered, what might not be covered, what would be covered under medical versus the drug piece of it. Again, we're entering the zone of not just saying it's going to take care of me. We're in the zone of we need to ask a lot of questions to get the answers that we need to have to make sure that you have the appropriate coverage to support the treatment and anything thereafter. Okay? Yeah.
Well, I'm going into Medicare, I just turned 65. And they'll say, what are you on? And, I say an eye drop. And so they go, well, you don't need to spend anything except for here, get this eye drop. And I go, but with what we have, we don't know what's in the future.
Right.
So, and then the other problem I wanted to ask you about
Yeah.
is, we go to a hospital, and I'm insured under my husband right now. They keep putting everything in his name, like he has cancer. And that's been...
That's a problem.
And I said, I called them up, and like, he's being really nice about it and talking to insurance, but I called up when I was paying the bill, and I said, this has been going on for 6 months, and it not only is, if he went to get life insurance, he'd be turned down. And the lady goes, I didn't even think about that. And she goes, oh, well, get on it. And I go, well, you've been saying that for 6 months. And I said, meanwhile, my deductible and all that is not going in my name. It's looking like he has ocular melanoma when I do, and there is nothing we can do about it. And you always get a different person. So who would you, what would you do to get rid of that?
Get a case manager first of all, because those people will get empathetic with you or your husband, and then ask the case manager to intervene.
Because, last time I talked to him, I had somebody said, we're working on it. I go, well, you've been saying that for 5 months.
Yeah.
So they get me somebody that says she's a supervisor.
We were having problems getting authorizations,
Yeah.
The oncologist wanted to move a certain speed, and, it would take 2 or 3 weeks to get an authorization. Finally, I just called, and I'm the supporter, but I said, my wife is just going absolutely up the wall here, because every time we turn around, you don't authorize things quickly. And I said, what can I do? Who can I talk to? I said, every time I call, I get a different person. They said, oh my gosh, we should have recommended a case manager for you. One got assigned. And now it just goes a whole lot smoother. I call that case manager. I know her name. She knows who I am.
Yeah, I don't know if they do that for billing now. But I said to him last time, I go, do you realize my husband doesn't have cancer? He's in perfect health. And he would not be able to get life insurance because of this?
I would get a case manager and get the case manager working on that for you and just say, your company is not responsive to our basic administrative need here. And, I'm the one with cancer. You guys aren't responding. I need somebody that I can talk to every time until this is fixed. And I did it with the authorization part. I need somebody we can talk to every time.
Yeah.
I need one of these because we don't want it to take 3 weeks. And all of a sudden things got way better. What she's saying about case managers is really a good thing.
Did you want to add?
Case manager, that's with the healthcare provider, that problem is not with the insurance company. Can you get a healthcare or a case manager with a healthcare provider?
Absolutely. Absolutely. They're maybe not called case managers, but yes, in many healthcare institutions, we have navigators, and generally they're nurses, and they'll work with you. In your situation, on its purest form, it's a breach of confidentiality. It is breaking HIPAA requirements because of the fact. Now, I would suggest, and if it were approached to us, I would be shocked if we let that happen. But he's your husband. But think of all the information that has gone out to different people, to different providers, to the insurance company, stating information about false information. So,
he's not retiring. And I
yeah.
said, his life insurance is up there. And she goes, I never even thought about that. And I said, this is ridiculous. Because
Yeah,
how am
I
I going
would-
to get all this money back that we have to keep, that's my husband. He doesn't want to have bills all over.
Right.
So we pay him right away.
No,
But
that's really a
this is-
potential issue.
This is Thomas Jefferson in Philadelphia. It's really,
Yeah, I would.
because what are we going to say? I mean,
I would ask to
Yeah.
speak with the leadership of that area or administration with regards to the issue. Is the recommendation that I would do.
Yeah, if it was like, I live in Atlanta.
If you're not getting help.
If it was in Atlanta and it was like St. Emery, I'd be like, okay, blow you off. But this is where I want to go.
Right,
So.
right. No, I would take that. I would take it higher and have it addressed. Absolutely.
Yeah.
Yeah, I don't know about that. I mean, I don't know about that, but I do know that your concerns are very warranted, and there could be HIPAA violations. So it's really something that I would say escalate that to leadership. And if we can't get it managed in the department, if you can't get it managed in the department, then ask to speak with an administrator. And I'm sure they would pay, I'd be very surprised if they didn't pay attention to that.
Yeah, they haven't yet, it's been 6 months. And listen, I was a car salesman, I'm not like very quiet. And, you know, he's really sweet, I'm not. And I'm like, this is ridiculous, I just realized he can't get life insurance. Because when I call for life insurance, I let mine lapse. They're like, nope, you have cancer, no life insurance.
Yeah. Oh, that's awful. Did you want to add
I
something?
have a quick question.
Yeah.
The prescription part of
Okay.
Medicare.
Yes.
Because I'm going through that right now, trying to pick my prescription plan. What are the questions, because there are like hundreds of prescription companies out there, what are the questions that we ask to make sure that we are prepared if we do need a new drug next year? Or what do we, how do we prepare for that?
Well, just as this gentleman, what's your name? Angus? Hi, Angus. Just as Angus recommended, I would go to that Social Security website and the Medicare website, and I would just scour it to find the information that you need. I am not an expert on Medicare. All I know is the more we ask, and Google is very powerful for us to get more information. And you know, there are local offices that you can go and you can talk to as well to try and get that additional information. I'm honestly kind of surprised. I've seen a few commercials with regards to it this year, but I haven't seen very much. Yeah,
I have gone to so many, you know how they have the people that you
Well,
go
that's
and
what I'm, yeah.
and every one of them says, what are you on? I'm like, you know, co-stop or whatever. And they go, oh, okay, that's good. I go, but you can't go buy that one drug, because what happens if
Well, that's
you
what I'm talking
metastasize
about,
and
yeah.
you need something?
Yeah.
But I'm doing Medicare.
Because it lasts for
plan
a
out.
year. I mean, whatever we sign up for now
Right.
is the prescription company that we're gonna have for 12 months.
Well, the other thing I recommend too with regards to the drugs specifically is reach out to the drug provider. So the pharmaceutical company, whatever the case may be with regards to the drug, to see, well, you can talk about the drug you have now, and you know, maybe that provider would be familiar with it. I don't know. I know you're pharmaceutical, not this piece of it, but just, you know, just the idea of, you know, we're challenging our pharmaceutical vendors all the time, and they have been extremely responsive. And it's just amazing what's out there and available. And with a lot of the drugs, they do have that same type of program. They could work with you, and they may have a good idea too of what the Medicare benefits are for that as well.
Ads that come on TV and say at the end, if you can't afford your prescription, we may be able to help you.
Yeah.
But then what do? Look at how much money you make? Like yesterday I was told I'm gonna need Eylea because Avastin isn't working anymore. And he said, you're gonna have to pay for that yourself because they're not gonna cover it. And it's $4,000 every
I'd call the company.
Yes.
weeks.
No, they have Eylea, as long as, I think Medicaid is the poor person, right? Medicaid, as long as it's not on Medicaid,
Yeah.
Eylea has a plan, they reimburse the doctor.
So if you're poor, you could get it, but
No,
if
you
you're-
can't, no, if you're on Medicaid, you can't.
You can't.
Everybody else can.
No,
It's
it's
the
he told me yesterday, you
Eylea?
can't. It's 4,000.
Eylea
Every
pays
6
for my,
weeks.
my injections, I'm not, and I have insurance.
You
They,
get Eylea?
I get Eylea. My, so it's, the usual and customary is not 4,000, it's 2,000. You would say the usual and customary is 2,000. That's what the insurance companies pay, and that, and so when I get an EOB from my insurance company, that's $2,000 for the Eylea, they get reimbursed by the company. My doctor gets reimbursed with that company.
Yeah, and then if you're having it done in a facility, often too, as a provider, we have agreements with the drug companies as well, that we will do a trade out. We do a trade out of the drugs. I don't know all the details on that, but I know that that also helps in many instances too, when our patients, when it's a particular drug that is a challenge for our patients. So the drug companies have been really, I've been very surprised. They have just responded so well, and they have so much available for our patients. You know, sometimes I feel like they get a bad rap, But when it comes to supporting and assistance programs, some of our highest dollar drugs, we have a lot of success with working with those pharmaceutical companies and our patients to get reimbursement. So,
It doesn't work anymore.
yeah, I'm so sorry. Those are the recommendations. Also, too, I just discovered this website. It's called needymeds.org. Needy, Needy, meds.org. And it has just got a lot of information, and it's specifically find help with the cost of medicine. I didn't dive in a little bit, but I was trying to do some research before coming here, and I found that website, and I wanted to pass it on. I don't know anything about it, but it was one that our cancer support community was familiar with, and I just wanted to pass it on to you guys to take a look, because I know the cost of drugs is huge when it comes to cancer treatment.
It was .org.
It's .org, yep, needymeds.org. Let me just cover a few more things. Want to make sure that you guys, everyone understands FMLA as far as your employment. You are entitled to 12 weeks of FMLA, family medical leave, with your work.
Only certain employers.
Yes, there are criteria for that, but think about that too with your employer. If you have to take any extended time off, it does protect your job. There's also the American with Disabilities Act, though, that also is another mechanism that can be used with employers to protect your job. The employer has to agree to it. I mean, there has to be some checks and balances on that. That is also an option for you. Do not forget about that. We already talked about Social Security disability. Community resources, there's lots of community resources. There's county resources. There's many factors. There's a lot of websites that are out there to support folks with cancer. If any of you have retirement plans, there are some provisions in some retirement plans that allow you to borrow money in hardship situations as well as loans. Hardship situations, sometimes they don't have to be paid back. You might be heavily taxed on them, but you figure the lesser of the two evils. Or there are some loan opportunities too. So if you have a retirement plan, same with life insurance, some life insurance plans do have some provisions that can help you in times of hardship to be thinking of. If you're 62 years of older, there's a reverse mortgage that could be done that could potentially help as well. Yes, it's not the ideal situation. It's not the ideal situation, but it's an option. And actually, I met with someone the other day who was a financial planner and advisor. And, depending on your situation, you might want to look at consulting a financial advisor too that can help with a lot of this stuff for you. And, you can't emphasize enough how important for you to manage this process is and how active you are in it. And that can't be emphasized enough. And of course, we've got, a cancer website, the American Cancer Association at cancer.org, that also has a lot of different resources that could be available for you as well. Okay, that's it. Yes. Oh.